Yeah. All right. So we'll quickly look at this topic. Infection. Look at this topic very briefly and join it with the second one. We'll do that within a short time. It's not too lengthy. So, by way of introduction, I would like to bring up this topic. Um, so, infection, infection from our medical parlance and expression has its own description or definition. When we say infection in medicine or infection in pathology, is actually different from the normal layman's expression of infection. So what is infection? Infection is the invasion. That word is very important. Invasion must be an invasion and multiplication of microorganisms like bacteria, viruses, fungi, or even parasites within the body, causing a reaction that can lead to a disease. Please let me go back again on that definition. An infection is the invasion. There must be an invasion. And then number two, the invasion of the microorganism must multiply. Is when the invasion succeeds, the multiplication succeeds. And this invasion and multiplication will involve things like bacteria, viruses, fungi, or parasites within the human body. Then that reaction that will ensue now lead to a disease. That is what really infection is all about. But if you remember, or if you see the use of the word infection among many lay people, they'll just think that if somebody has PID, that's infection. If somebody has genital discharge, that's infection. But it's beyond that. Malaria parasites can be defined as an infection. Fungal parasites, fungal organisms in the body can actually be termed infection. Viruses is an infection. Just for instance, you say HIV virus in a person. That HIV virus is actually a form of infection. It's a viral infection. And then most commonly used is a bacterial infection, which most people think is the way to define infection, but it's beyond that. Now, summary there is that for infection to be defined for an individual, the microorganism here are those things that cause the infection. You cannot see them. They're actually very small to be seen by the human eyes. Those are bacteria, viruses, fungi, or parasites. When they invade the human body and multiply and cause a reaction that leads to a disease, so we say that an infection has taken place. Now, when infection is ongoing in a person, the symptoms can vary, but usually most infections usually come with fever. Usually, most infections come with fever. But it's not that it must be there. It usually, most times, come with fever. Sometimes the person could be tired easily, and then you could also have localized issues like redness or swelling. If you recall this area, we're talking about inflammation. So infection can lead to inflammation. When we talked about inflammation, we mentioned redness, we mentioned swelling. Depending on the type of the pathogen, that is, depending on the type of the microorganism and then also the immune response of the body. These two factors determine the symptoms of the individual. Infections can be transmitted in many ways. Usually, it can be through the air. Example is tuberculosis. Or it can be through contaminated food or water. Example is typhoid. Or it can be in contact with other individuals. Example is ringworm. So you see the way they are coming is not the same. Tuberculosis or pneumonia, food or water, which is where we have your typhoid fever. And then we also have contact with other individuals. Example there is ringworm. Those are all forms of infection. Now look at this picture. It shows that different forms of infection can affect different people with different outcomes. This is a commonly known infection among women, vaginal infection. Usually it presents, there are different types of vaginal infection, no doubt. Usually this one is going to be more of bacterial, and this is what we call the PID, pelvic inflammatory disease, where people say the person has infection, is beyond that, as I've said. It's just that in this particular individual, the infection is strictly tied down to the genital area, but it could go to any other place. So for this particular person, we see a vaginal infection, which may present with itching or no itching. That is one. It may present with discharge or no discharge. That is two. Number three, it may present with low abdominal pain or even a fever. And talking about infection in the female genital tract, we have what is very commonly known as the vaginal candidiasis. Vaginal candidiasis usually comes with a discharge, whitish, like ogi or pap that is solid. And then it comes with itching, yeah, because the organism that causes it is a fungi organism. That organism usually, yes, that organism usually, okay. That organism usually has its predilection for the genital area. And then I think, I don't know whether the person is saying is not seeing the slide. Is everybody seeing this slide? This is the second or third slide. Please confirm whether you're seeing this slide, please. Somebody said it's not seeing the current slide. I'm showing it on the screen. If you're not seeing it, please let me know because I'm using this slide now.
It's not showing it, sir.
Okay, it's not showing the slide. Okay. I'm going to.
Which one? The
Okay. Yeah, so no problem. By the time we move on, this slide, you see it in the presentation. I'm wondering why it's not showing, but actually it's a pictorial slide. I'm showing a picture of a young boy who has red marks on his body all over. This is actually a staphylococcal infection of the skin or streptococcal infection. It's showing the red spots all over his body. Then on this same slide, I'm seeing a woman that seems to have a PID infection, showing her on the same slide. Then on this same slide, there are three images there. The third image is like someone that has something like a boil on the hand. All of them are showing signs of infection. It's very clear. Let me go to the next slide. Maybe you can appreciate that. Are you seeing the next slide here? I've entered the next slide. Please, have you seen it?
Your screen is not showing, sir.
It's still not showing. Okay, what about this one?
Showing, sir.
It's showing. Yeah, I think, yes, I don't know what happened, but all of them are supposed to show because they are all from the same source. All those slides are from the same source. All of them are from the same source. They're supposed to show. And, okay, this is the one you said is new.
Didn't show before.
Yeah.
Maybe you share the slide. None of it showed. Started, yes.
Mobile Salah, is this one showing? Are you seeing anything on your screen now?
Seeing anything? Maybe you should share your screen.
What about this one?
Not sharing, sir. It's only that word. That what is showing on the screen is recording average sense by abstract.
Should we stop sharing and come back again with the slide?
Yes, that's what we
I think so. What is your experience now?
It's showing now. I can see the human body.
Okay, fine. Okay. Let me go to the previous one. Whether you are you seeing anything now?
I can see infection. Yes.
You have
It's
seen
showing
this
now.
one now, infection.
Yes.
Okay, fine. So what about this one? Are you seeing this one now?
Yes, I can see the hand.
Okay. All right, fine. So this is where we were. This is the place that we were. So we are saying that actually infection can be any part of the body. It can be on the skin, it can be inside the body, it can be on the hair, it can be anywhere. So I was trying to actually explain that for most women, infection, genital infection is common, and then we have different types. We have those ones that come with itching. We have those ones that don't come with itching. And then even at that, we have those ones that come with whitish discharge. Then those ones that come with yellowish discharge, what we call bacterial vaginosis. Some of them respond to antibiotics. Some of them respond to antifungal agents. There are different types. And then, like we said, outside the genital area, even on the skin, like this picture I'm showing you on my extreme left, is a young boy that has a skin infection all over. The next one too is on the hand, like a boil. These are all forms of infection. Now, this is a classical example of how infection enters the body. Now, these microorganisms you're seeing, red color, blue color, green, these are microorganisms that you cannot see with your eyes. Sometimes they can be available in the atmosphere, available in the air. And when the person breathes in the air, which is contaminated with the microorganisms will find their way into the lungs. You can see these lungs on the right side is actually red, meaning that it has trapped the microorganisms. Now, when the individual's body or the immune system is not strong, it will succumb the person's immunity, meaning that the person will now fall a victim of that disease process. And before you know it, because the matter is on the lungs, he can start having chest pain, he might start having cough, he might start having difficulty in breathing. And this also is dependent on whether the infection continues or the body is able to handle it. If the infection continues and the body cannot handle it, this can actually lead to the death of the individual. So we are saying that infection can be anywhere in the body. Now, those bacteria that cause this infection are very small, very, very small. You can't see them. It will only take a microscope to be able to appreciate them. Some of those microorganisms, they are like, the appearance is like a chain. Some of them, the appearance is like a rod. Like this ones you're seeing here is a rod-like appearance. They have the appearance of a rod, so that you would think that it's a rod-like, it has a rod-like appearance. That's just that. So this one too, this is another picture showing that you see all these circles, 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 circles. Those are different types of microorganisms that one can actually see. Those microorganisms are different types and different sorts. Different types, different sorts. That is why it takes you to another lecture that says types of bacteria, types of viruses, types of fungi, because each one of those viruses, fungi, and bacteria will have different effect on the body. Look at these present ones. You can see that these ones are like rods. You see, there's like sausage rods. These other ones are round and circular. These other ones are like worms. You can see them, thread-like worms. These other ones are like green plants. When these ones enter into the intestine, they can cause a lot of problem. These ones enter the lungs. This one enters the GIT. These ones enter the muscle. So each one of them is going to cause its own problem. Now let's look further as what can happen when these microorganisms enter into the body. What exactly do they cause? Look at this picture. This picture is telling us the different parts of the body and the different infections that can actually take place. And we call them opportunistic infection because normally, for a person whose body is normal and sound and the immunity is strong, the person shouldn't have problem with infection like that. But when the person's immunity is low, it can make him to have those problems. So let's take it from the top to the down. In the brain, most times, if the infection thrives in the brain, that can lead to meningitis. And meningitis have different types. They have bacterial meningitis. But in this present case, you are seeing cryptococcal meningitis. This is very uncommon to normal people. It usually will occur when the immunity is low, because the organism here called Cryptococcus organism is actually a fungal organism. By right, on a normal day, it will not cause any problem. But when the immunity is low, it will find its way into the body. Toxoplasmosis is another brain problem that can occur. For the eyes, we have retinitis, even ocular syphilis, syphilis entering the eye. Then for the throat, we could have vagina, the same thing that occurs in the vagina we mentioned earlier, whitish discharge in the vagina. Some people can have it in the throat, especially people that their immunity is low, HIV patients, patients that have treated for cancer, people that have a very low immunity. Do you see, if you open their candidiasis or thrush, again, in the lungs, you could have pneumonia, pneumocystis, pneumonia, tuberculosis. And of course, you know by now that tuberculosis is very common with HIV patients, because the people that have HIV, their immunity is very low. So tuberculosis can actually thrive very well. Same thing with the stomach and the digestive system. We have human papilloma virus, anal cancer, tuberculosis of the people having vaginal candidiasis, yeast infection. That's what I mentioned earlier. Then you have people that have genital herpes. Hepatitis B and C is a common problem in the liver. Then you also have varicella, chickenpox, shingles, and so forth. All these ones usually come into manifestation when the immunity is low. That is why we are calling it opportunistic infection. Opportunistic because they are taking advantage of the low immunity to thrive. Otherwise, if the immunity was strong, it would not have been there. So examples of opportunistic infections are the list that is presented before you. Now look at this one. This is what happens generally, whether the person has immune system low or not. This one is normal infection for most people. And if you look at it again from head to toe, we have infection of the brain. This is bacterial meningitis. You see, bacterial meningitis can occur on anybody, but cryptococcal meningitis will occur majorly in those people whose immunity is low. Other microorganisms that can cause bacterial meningitis include Streptococcus pneumonia, Neisseria meningitidis, Haemophilus influenza, Streptococcus agalactiae, Listeria monocystages. These are bacteria that can cause meningitis. And of course, you know what we call otitis media, ear discharge. You have seen people that, especially young children, you see, look at the ear is bringing out pus, pus coming out from the ear, and it's very foul smelling pus coming from the ear. That is what we call otitis media. It is also an infection of the ear. Then we have pneumonia. There are different types of pneumonia. We have community-acquired pneumonia. We have atypical pneumonia. Then we also have different organisms that can cause each one of them. Then you come to the skin. The skin is very sensitive to microorganisms, especially things that have to do with Staphylococcus aureus and Streptococcus pyogenes, even Pseudomonas aeruginosa. These organisms are very common on the skin. Example, if you see someone that has a boil, a boil, especially a boil under the armpit, a boil around the neck, a boil anywhere, if you drain the pus, you see that the person can have relief. But as long as you leave the pus there, the place is painful, is red, and is uncomfortable. What is happening there is that under the skin there, the microorganism you're going to see there for a boil is going to be either Staphylococcus or Streptococcus. They find their way there and multiply and cause inflammation, and the person can begin to get very uncomfortable. The same thing with the eye. We have eye infections from Staphylococcus aureus, Neisseria gonorrhea, Chlamydia trachomatis, and then for the sinusitis. The sinusitis is the area between the nose, the back of the mouth, and under towards the throat. That is the sinus area. You have some people that have inflammation there. Every time they are bringing out phlegm, sputum all the time. Then we have those that have upper respiratory tract infection. These people are going to have a lot of symptoms like pneumonia-based symptoms, cough, catarrh, difficulty in breathing. Then we have ulcer, stomach ulcer that we all know, otherwise called peptic ulcer heart disease is also caused to an extent by a microorganism. We know that if somebody does not eat, it can worsen the ulcer. If somebody is taking aspirin, it can worsen the ulcer. But beyond that, we know that some microorganisms, which one of them is called Helicobacter pylori, H. pylori. When we see H. pylori in the body, it is the place you normally will see it in the stomach because it causes ulceration of the tissues, causing an ulcer to be available. Then we also know that food poisoning is caused by microbes. When we say food poisoning, we are looking at, for instance, you cook food in the morning, you didn't warm it again, afternoon, 8 hours later in the evening, you didn't warm it, then you forgot. Maybe by the next morning, you want to eat the food. You don't know that because it was exposed to the atmosphere, some microorganisms in the atmosphere have started thriving on the food. Eating that food now, the person may wake 3 hours later, 6 hours later, 8 hours later after eating that food, the person begins to complain of abdominal pain, sometimes vomiting, going to toilet. All those ones is what we call the food poisoning. And food poisoning can kill because the organisms release a lot of toxin into circulation. We've had cases of people that a family will eat food, everybody dies in that family, or maybe the food was contaminated. All those ones are from infections. The same thing with urinary tract infection. The person goes to urinate, and during urination, there is pain on urination, heavy pain, and the person can feel uncomfortable. Urinary tract infection is a form of infection. So by this slide, we are trying to say that infection is not narrowed to one side. It could be any part of the body. Same with sexually transmitted infection. Or even gonorrhea. Gonorrhea is a very common sexually transmitted infection. So this takes us to types of infection. We have bacterial infection, usually caused by viruses, such as those that cause streptococcal throat or pneumonia. We have viruses caused by bacteria was the first one. Then the second one is virus, such as the one that even common cold. You know, the commonest sickness they say is common cold, and that is caused by virus. Even COVID-19 that was very popular at that time is also a viral infection. Then we also have fungal infection, which is caused by fungi. These fungi sometimes are ringworm, which is very common among young people, or even what we call athlete food. Have you ever seen a situation whereby somebody went out, he wore sneakers, he wore canvas, went out, came back in the evening, and then he removes the sneakers or the canvas, and you perceive a very foul-smelling odor coming from the shoe. Then he keeps on wearing that shoe. Then after some days, you look at his legs. In between the toes, you see that there's an opening, there's a wound there. And that wound is foul-smelling wound. That is what we call athlete foot. And it is actually a fungal infection. Another thing that can cause infection is parasites, such as hookworm. Hookworm, especially in the stomach that sucks blood. What are the signs and symptoms of infection? Number one, it could be with fever and chills, just like malaria. The person could be tired. The person could have cough or sore throat, especially if it is a pneumonia symptom. Sore throat is very common. You cannot swallow. The place will be paining you. Even to drink water and take solid food may be painful because that place is swollen. And the reason why it is swollen is because there is infection causing inflammation. That place may be red, it may be swelling or pain in a specific area. There may be shortness of breath if the lungs are affected. There may be diarrhea or vomiting if it is food poisoning. There may be unusual discharge, especially if it is a vaginal infection or irritation. Just like yesterday, I was here, one person called me from Port Harcourt. She's a medical student. I know her very well. She changed environment from one place to Port Harcourt. I think she started using their toilet. And this yesterday now she called and said, no, that she uses the toilet all the time, but that she's feeling uncomfortable in her genital area. I asked her, is there any discharge? She said no. Is there any itching? She said no. I said, so what is the experience? She said, what is just feeling uncomfortable and irritating. As she was talking, I knew that this is actually an initial stage of a PID, that's pelvic inflammatory. I told her what to do. So it's a common thing. Infection is all over, in the toilet seat, in public places, even your phone, your handset. I hope you know that what the kind of bacteria your handset contains is numerous. Even on the table, the share public places, buses, we are always careful about. And for those children to carry your phone and put in their mouth could be very terrible because of the microorganism. So how does this infection get transmitted? They could be one person to person. Person to person is very important, especially in cases like tuberculosis. Somebody is living in a room. This other person has tuberculosis. All of them are staying together. The person that has tuberculosis eventually will pass that tuberculosis to the other person that is not having it. So we have person-to-person transmission, which may be direct or indirect. Sometimes may be through body fluid, blood transfusion, kissing someone, and then having sex unprotected. The bacteria, the semen, the fluid can be exchanged. Hepatitis B and C can cross very well from one person to the other, or it might even be other kinds of infection. It could also come from contaminated sources when when they consume contaminated water or food. This is common in typhoid. Typhoid is not from mosquito. Please let us take note of this very importantly. There are some people that say, he has malaria and the malaria has turned to typhoid. There's nothing like that. Typhoid is strictly from contaminated food or water, whereas malaria is coming usually from the bite of a mosquito. They are not related. It's just that the symptoms almost always look alike. But if you see a real typhoid patient, is usually worse off than the malaria patient. Then we also have things like vectors. Vectors are insects that carry from and all that. So we look at the environment too. Apart from vectors, contaminators, the environment plays a major role. For instance, somebody is walking on the farm barefooted. He's under the soles of his feet, picks a nail, and the nail enters his skin. Before you know it, this person can come up with tetanus. It's from the farm, from the ground. That is why infection is everywhere, everywhere. That is just the bottom line there. So how do we reduce infection? One way is by vaccination. And I think at this point in time, I'd like to ask us, if you're a health worker, please, you need to be very serious about vaccination because while you are attending to other people, it's possible to meet different types of people that are sick and one can contract a disease. One of them particularly is hepatitis B, hepatitis C. Hepatitis C has a cure. Hepatitis B does not have a cure, but both of them can be passed from one person to another and eventually lead to cancer of the lungs, cancer of the liver. And that's a very serious issue. So we normally will encourage all health workers to get vaccination for hepatitis, at least. Get vaccination for hepatitis. And usually it's I think in most places, either free or you're not going to even pay up to 5,000, you get it, and be sure that you have vaccination. If you have vaccination for hepatitis, and maybe tomorrow you are in touch with someone that has hepatitis, you cannot have it because already you have vaccination. I will not ask you how many people have had vaccination, but I hope the message is clear. Number two way to overcome infection is personal hygiene, especially hand washing. As simple as it is, do you know the number of bacteria on your hand? Very plenty, very, very plenty. So we wash hands as often as possible. We avoid contaminated food, contaminated items. Then we also practice safe habit. When you're coughing, you cover your nose. If you're inside the public transport where somebody sitting beside you is coughing, please take cover for your life because you don't know what the person is coughing out. Let's go to the next thing, immunity. So how does the body handle these diseases when they come into the body? Number one definition is that immunity is the body's resistance to disease. Usually, the body fights against bacteria and viruses. This protection is very necessary because without it, almost everything would have killed human beings. And we also know that this protection can be natural or man-made. Man-made is through pre-made antibodies, or natural is the body's natural way of fighting the opposing agent. So the immune system uses network of cells or chemicals to identify and ward off threat. If, for instance, you've had a malaria before, now the second time you're going to have malaria, the body will remember that this disease has come before, and the body will now fight it. That is why immunity for those that are Africans, when you have malaria, you can withstand it, you can survive. But bring a white person, or Igbo person that has never had malaria before, he cannot be able to stand before malaria because the immunity is not there. Most black adults already have immunity, and the body is able to remember because there was a time you had it before, you survived it. So subsequent ones, the body can be able to handle it. It's when the body cannot handle it that you not take medication. So what are the types of immunity? We have active immunity. This occurs when your body system responds to an infection. And when your body responds, it produces the soldiers of the body. These soldiers, we call them antibodies. They fight against specific microorganisms. It can be long-lasting. And then we also have passive immunity. This happens when you receive antibodies from external sources, especially from a mother to child or through a medical treatment. If you look at a child that is born, first 6 months, most children are very strong. Most children are able to withstand a lot of health hazard. Why? Because the antibodies from the mother was passed to them, and they can be able to withstand a whole lot. The next one is innate immunity. Innate, inside born. That means the person was born with it. This is usually the first line of defense. It is non-specific, and it includes your skin. Your skin will protect your body from microorganisms. Your mucous membrane will protect you. So the innate mechanism or innate immunity is a very first type of immunity. Then we also look what are the components of the immune system. The components means what exactly makes up the immune system. We have the white blood cells. We have the immunoglobulins, we have the lymphoid organs, we have the complement system. All of them work together. The white blood cells are actually the real primary cells of immune system. They are able to eat and dissolve microorganism. They work by lymphocyte, which may be B or T lymphocyte. The antibodies are proteins produced by the B cells. They are able also to destroy any offending organism. Then we also have the lymphoid organs. The lymphoid organs here are things that are able to produce immune cells. Example, the bone marrow, the spleen, the tonsils, and then we have the complement system. These are proteins that enhance immune response, and all of them work together to kill an offending microorganism. So we have the B cells, he attack the invaders outside the cells. Then we have the T cells that attack the cells that are already infected. So B and T cells, which eventually are the component of white blood cell, they can fight organisms from anywhere. So immunity, wards off infection. That is the summary of the entire talk about the immunity. Immunity removes or wards off infection in human body. So ability of the human body to resist infection, like we said, is called immunity. And there are three layers: the barrier immunity, innate and acquired or adaptive immunity. Under the barrier immunity, the skin, the human skin, provides a very strong resistance against microorganisms. Why? Because the skin also contains some immune cells, and usually when the skin sheds off gradually, it sheds off with the infectious agent. Then along the respiratory system, we have some cilia that lines the airway. Anytime an effective agent enters the airway, it will dissolve it. Then the human tears also kill microorganisms. Like we said before, innate immunity is the one the person is born with at birth, born with it at birth, and it is not specific. It's made up of various cells and different complement system. The cells of the immune system are many, like we've mentioned, the neutrophils, the basophils, the monocyte, the macrophages, all of them are immune cells. Mast cells, dendritic cells, natural killer cells, these are all cells that come to help in immunity. The same thing being mentioned here. Okay, look at this slide. First exposure to a disease is the response of the body is very low because this is seeing it for the first time. But after that, the body keeps a memory of the disease. In the second exposure, third exposure, a lot of antibodies are produced because the memory of the cell knows that this disease had come earlier. So the body this time around is ready to attack and take care of disease. This is all about more of it. The blood come into play and so forth. I think let's go to the last part, hypersensitivity. Now, even though we know that immunity is very protective, but it can be exaggerated, it can be out of normal. So we have hypersensitivity. It's an abnormal, exaggerated immune response. Usually when immune response comes, it's supposed to handle only the bacteria or virus or the agent that is causing this. But in hypersensitivity, it knocks off the agent and knocks off other parts of the body. So what happens? We now see that there are different types of hypersensitivity. We have type 1, type 2, type 3, type 4. Now, type 1 is immediate. That is when people respond to allergy. Allergic reactions can actually predispose to immediate hypertension. And that one you see in people that are exposed to anaphylactic agents, things like asthma. Asthma patient, immediately they come in contact with whatever is to cause asthma for them, the body will quickly react. And in that reaction, the person can even die of the hypersensitivity reaction. Then we also have type 2, which involves IgM and IgG antibodies. Example is hemolytic anemia. We have type 3 hypersensitivity. This is seen in people that have serum sickness. And then type 4. Type 4 is seen in very chronic illnesses like tuberculosis and the rest of them. And then what is the cause of hypersensitivity? It is a result of the body's immune system damaging tissues rather than the substance itself. This can be triggered by external factors such as pollen, peanut, or the body's own immune system is having a challenge. It may be a genetic problem because some of these immune problems can run in families. Some people have hypersensitivity, and if you trace it, it's found in their lineage and so on like that. So this is an explanation of all the hypersensitivity reactions. And then how done? What are the natural ways of boosting immunity? Majorly is through diet. Most of the diet we know that we eat, if people eat to survive, not because they are looking at a way for immunity, but it's good to know that some things can enhance immunity, especially fruits, citrus fruit, berries, leafy green vegetables, ginger, garlic, and yogurt. Why? Because they contain a lot of vitamin C and D. And then they also contain antioxidants and probiotics. Yogurt is a source of probiotics, which help the body to fight infection, protect it from damage, and support the immune cell system. Other beneficial food include things like fish, poultry, and certain spices like turmeric. Then we also know that vitamins and antioxidants are very, very vital, because like we said earlier, high level of vitamin C, especially the orange family. Then we have berries, strawberry, blueberry, and the rest of them. Leafy green vegetables, spinach, they all contain a lot of antioxidants. Then we have a lot of beta carotene, which is found in sweet potato, which contains a lot of vitamin A, almonds, vitamin E. Now, let's know that vitamin E, vitamin A, vitamin C, all of them are called antioxidants. So they mop up free radicals that can cause cancers and cause other challenges. Then, of course, we mentioned probiotics, which is found majorly in the yogurt and related example like that. Then spices, ginger, garlic, turmeric, they are all known to cause high level of immunity, especially turmeric. Turmeric contains curcumin, a compound known for its immune supporting benefit. These are natural ways of taking care of immunity. Now, let's go to yet another presentation. The last one is going to be brief, which is the second part of the presentation, so that we can actually call it a day here. I'm going to talk on the second part of the lecture, which is supposed to be tomorrow, but for the want of time, we all know tomorrow is going to be busy, so I think it's best I take it today so that we can know. I hope you're seeing me. Are you seeing the slide? Let me hear your voices. Are you seeing this slide? Endocrine pathology. Hello? Are you seeing the slides? Okay. Let me see. Okay, so please verify now. Are you seeing it now? Fatima, are you seeing the slide now? Are you seeing the slide now? Hello, anyone
Yes,
there?
sir, we
Are
can
you
see
seeing the slide
it.
now? Okay, all right, thank you. So let me do this one very fast. Yeah, thank you. Now, Ebere, please verify whether you're seeing it.
Yes, sir, I can see the slides. Good afternoon, sir.
Okay, fine. All right, thank you. So let's rush these slides with understanding. All right, so I'm looking at endocrine pathology. And under this one, we're looking at diabetes, thyroid problems, and adrenal disorders. This is very important because you're going to see a lot of people with diabetes. It's a common problem. And this is very, 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 very important as we speak, because a lot of people are having this challenge, but we must know exactly what is this matter all about. So we now take it under a definition and under endocrine problems. Diabetes is an endocrine problem. So what is diabetes? Diabetes is a chronic, please take down note of that word. It's not something that just started now and it ends now. It's something that has been ongoing. So it's a chronic problem, a chronic metabolic disorder. Diabetes is a chronic metabolic disorder characterized by high blood sugar, which in bracket is actually glucose. We don't even use the word sugar again. We use glucose because that's a real problem. It's glucose, not sugar, resulting from the body's inability to produce insulin or to use insulin. I'm going to explain this so that you don't cram it. Maybe I'll come back to that definition, but let me go to this table. Look at this. Look at this slide. Now, normally, when you eat food, and that food is carbohydrate containing, example, gari, yon, and all those stuff like that. When you eat it, those food, we know it will be called carbohydrate-based food. Eventually, when the food enters the body, it will be converted to glucose. Whether it's starch, whether it's gari, whether it's apple, whatever, rice, yam, it's going to be converted to glucose in the body. So the body is receiving it finally as glucose. Now, this glucose will move to the blood after you have eaten the food. It will move to the blood. That is why you're seeing number one, glucose in the blood, because it has left the intestine, it has moved to the blood. So glucose will not be in the blood. When the blood glucose begins to go up, maybe it was 3 millimoles, or moved to 5, moved to 6, because you just ate a carbohydrate food, containing food. There is another part of the body called the pancreas. This pancreas will sense that the blood glucose is going up. So it's going to produce insulin. Pancreas will produce insulin. That's what you're seeing there. Number two, pancreas will produce insulin. And then this insulin now, which is produced, will come to that blood, will come to the blood and begin to lower the value of the blood glucose so that it does not get too high. And it does that by converting the blood glucose into the liver. It sends it to the liver so that it will be stored there. It will store it there. It will store it there. And then that means the glucose now is in the liver, so that the day that you don't eat, it is that one that will come out and give you energy. That is why sometimes from morning till night, you don't eat, you're not slumping, you're not falling down. It's because the one you stored in the liver, the body is using it now. This is how the body handles excess glucose. Let me come again. You eat carbohydrate food, it's converted to glucose. The glucose now begins to go up in the blood. Pancreas notices that it releases insulin. Insulin will now come and lower the blood glucose by converting them to glucagon in the liver. That is what happens. But now, in people that have diabetes, the glucose is high because nothing is restraining it. This insulin, which is normally produced by the pancreas, is not produced. Is not produced because the pancreas is means that people that yes, that means that people that have diabetes, they don't have insulin. And because they don't have insulin, the glucose will begin to continue to go up. And all the problems of diabetes is because the glucose is in excess. So that takes us again to the definition. A chronic metabolic disorder characterized by high blood glucose. Why? Resulting from body's inability to produce insulin. Or sometimes the body can produce the insulin, but it cannot use it. All of them will end up in high blood glucose. So the symptoms are many. It can lead to excessive thirst, urination, tiredness. Sometimes it may even lead to blindness. That is what diabetes do. What are the classification? There are different types of diabetes. The most common one is type 2. Type 2 diabetes, they have insulin, but the insulin is not effective. Then type 1, there is no insulin at all. Type 1, there is no insulin at all. Then for the third one, we have gestational diabetes. In gestational diabetes, the person is pregnant and during the pregnancy become diabetic. After the pregnancy, the diabetes may resolve or it may continue. Then we have the last one, other types of diabetes. That is not type 1, it's not type 2, it's not from pregnancy. How common is diabetes? Approximately 37 million people in the US have it currently. Then all over the world, we have about 537 million people. That means it's a whole lot of problems. About 8% of the world population having diabetes. What are the symptoms? The symptoms include being thirsty all the time, frequent urination. If the person has a wound, the wound cannot heal. And then we also see that the person has being tired easily, blood vision, the weight loss, person begin to lose weight if it is type 1. Oh, and then sometimes they have a lot of infection around the vagina, all those yeasts we mentioned earlier, even on the skin, all the time, boil. In the vagina area, you have a lot of discharge and they're urinating all the time. They feel thirsty all the time and so on. What are the complications? If care is not taken and treatment is not made, complications can set in. And these complications are divided into two. We have immediate complications and then we have the late complications. Immediate complications are things like what we call the hyperosmolar hyperglycemic coma. These people can go into coma very fast. They have diabetes, they finally go into coma. Or another complication is hypoglycemia. They're taking drugs for the diabetes. Maybe they overtake the insulin and it will tilt them to low blood glucose and they can go into coma. Another third possibility is what we call lactic acidosis. They can go into excess lactic acid and that can make them. Look at this picture. This person is diabetic. We know the complications are many. It can affect the eye, can affect the heart, can affect the kidneys, it can affect the teeth. But look at this person stepping on a needle. When the diabetes destroys the nerve, sometimes the people don't feel anything. Imagine someone stepping on a pin and does not feel that the pin has entered the leg. That is why you see them having wounds all over the legs. And they may not even know that there's a wound there, only for them to see that there's a wound later that is not healing. And that can lead to infection setting in, and that can lead to many of them. The infection can become so bad that they may need to cut off the leg of the person. So we've seen a lot of them have their legs cut from diabetes complication. These ones are the complication, diabetic ketoacidosis, which eventually lead to coma. Now, complications of diabetes, it can lead to stroke, lead to blindness, heart attack, kidney failure. In men, it can lead to impotence, and then it can lead to amputation. Most times, they have to cut the leg so that the person does not die from infection around the leg. That is what we call the amputation around there. Then we have the long-term complications. Long-term complications are the ones that cause the stroke, cause the heart attack, and even cause the kidney problem. Then, of course, that is it. Neuropathy, the person could feel numb, inability to feel pain. Then finally, the kidneys are involved. Then there's retinopathy that can lead to blindness. It can lead to food complications, skin infections that can lead to then erectile dysfunction. We mentioned that. They can have diarrhea, they can have constipation. People with diabetes are 2 to 3 times more likely to have depression than people without diabetes. That is to say that it also affects the mental status of the individual because they are usually not happy because of their condition. They can become depressed. We take the the second one, thyroid problem. Thyroid problem are also endocrine problem. Just somewhere around the neck is the thyroid gland. And you can see that it's an organ that is like a U-shaped organ somewhere around the neck. You can see where I'm pointing this arrow. That is where the thyroid gland sits in most people. It's very small. You may not even know that there's something there. But as small as it is, it controls a whole lot about the body. And if care is not taken, this can actually lead to a lot of problems in people. So let's explore thyroid problem. Look at it here. It's the same thyroid gland. Sometimes it can be inflamed, it can be swollen, it can have cancer and all that. So it has different diseases that can affect the thyroid gland. Now, that is it again. The thyroid gland is somewhere there. You can see this is the larynx, the voice box. This is the trachea where air enters the lungs, and just in front of them is a thyroid gland. Now, the thyroid gland makes the hormones that control the body metabolism. But when you have people producing these thyroid hormones, they can either produce it in excess, that is what we call hyperthyroidism, or they produce it very low, that is what we call hypothyroidism. And then we need to know that thyroid problems are more common in women than men. Yes, it's more common in women than men. Let's go further. Let's look at the hypothyroidism, whereby the hormones are very little. What are the symptoms of low thyroid? To gain weight? They are not eating much, but they are gaining weight. They are always feeling cold. Others are saying the place is hot, or they say the place is cold. They are always tired. They have hair loss, breathing noise, constipation. They have fatigue. They are tired easily. And then when you look at their neck, you see that there's a swelling around the thyroid gland. What are the causes? Well, the causes are many. Sometimes maybe inflammation, sometimes because iodine in the food is low. And this, you see the people having what we call goiter. The neck is swollen. Other causes is if they remove the thyroid. So these are which is the hyperthyroidism. In this case, the thyroid hormones are too much. They are too much, excess. And because of that, they are overworking. That will cause the patient to have fast heartbeats or easily tired, easily sweating, cannot sleep, restlessness, diarrhea, hyperactive. That's the extreme form of hyperthyroidism. Again, that is when you see the thyroid gland begins to get big and begin to swell up. And then you can now see the individual in normal life having an enlarged thyroid gland. That is what you see on the neck, thyroid gland. You see there's the same thing, enlarged thyroid gland, which is called goiter. And then we know that still for the hyperthyroidism, the people can become weak, they have trembling hands, and then it's always caused by overproduction of the thyroid gland. Let's go back to the slide I left here. What's the difference between the two? In hypothyroidism, the hormones are low, thyroid hormones are low. In hyperthyroidism, the thyroid hormones are high. Look at the differences. Hypothyroidism patients have dry hair, they have a swollen face, slow heartbeat, they are gaining weight even though they are not eating, they have constipation, their nails are brittle, they have arthritis, they feel cold all the time, they're usually depressed, their skin is dry, they have memory loss, and heavy menstrual period with muscle ache. Whereas those that have the excess hormone, they have hair loss, bulging eyes, they sweat all the time with weight loss. Yes, weight loss. Even though they are eating and eating and eating, they are losing weight. These other people, they are not even eating, they are gaining weight. These people have all the time regular gassing, soft nails, they have difficulties with sleeping, infertility, they are usually irritable, and they have scanty menstrual period, very scanty. These other people have heavy menstrual period. So you should look at the differences between hyperthyroidism and hypothyroidism. We mentioned this. Let's go to something more. Okay, we now look at the last part, which is the adrenal gland. The adrenal gland, before you can understand that, you need to look at this picture. Yes, this is the kidney here. Brown tissue is the kidney. Then on top of the kidney, we have another small gland called the adrenal gland. Everybody has two kidneys and everybody has two adrenal glands. So the adrenal glands, they sit on top of the kidneys in each person. So we want to look at the adrenal gland. The adrenal gland are endocrine glands located on top of the kidney, and they produce the hormones that regulate body metabolism. Do you know that your blood pressure is controlled from the secretions of the adrenal gland? Even your sexual activity, even your body metabolism, ability to respond to stress. For instance, look at this next right up. Each of these adrenal gland has an outer cortex that produces a steroid such as cortisol and aldosterone. And then it also produces adrenaline and noradrenaline for the fight flight response. Wherever you are hearing me from now, assuming, you just hear that there is fire outbreak, God forbid, though. Do you know that even though normally you are not used to running around, you are not used to jumping, you quickly jump, you quickly run, you quickly do something to escape that fire, is because there is a hormone in your body that makes you to respond to fight or flight. It makes you to do something that ordinarily you cannot do. If they lock you inside the house, your compound house gates, but you hear that there's fire in the house, you will jump out anyhow, out of the fence. How did you jump? Even you cannot explain. The reason is because the body notices that emergency will always come. So it places a demand on your body to produce adrenaline. It is this adrenaline that is called a fight or flight response. It makes you to defend yourself in case of emergency. So you can imagine how it would have been. We can never respond to emergency. We can't do anything. God is wonderful. Like I keep saying, the body is very, very complex. So God makes it easy for us to respond. Where's the adrenal gland located? We said it on top of the kidney, and it's divided into two parts: the cortex, which is the outer part, then the medulla, which is the inner part. What is the function of the adrenal gland? It regulates your body metabolism, your blood pressure, and immune response. Then it also it releases cortisol. It releases your sex hormones. What makes a woman to be sexually active, what makes a man to be sexually active is because of the hormones that are produced from the adrenal gland and the ovaries and the testes. If those hormones are not there, everything will just fizzle out. So if somebody does not have these hormones, of course, it will mean that infertility can even be a problem. There's still talking about the adrenal gland, what they produce. I've mentioned the fight flight hormone. And then we also know that when there's a problem with adrenal, there are two problems that can come. It's either the adrenal hormones are not being produced or they are being overproduced. That is how usually it comes. If they are overproduced, we call it Cushing syndrome. If they are not produced at all, we call it Addison's disease. So you must know the difference. In Addison's disease, the glands do not produce enough cortisol. But in Cushing syndrome, the body has high level of cortisol. So it's either it's overproducing or it's not producing. Other disorders that can come include Cone syndrome, pheochromocytoma. In pheochromocytoma, the patients have high blood pressure. In Cone syndrome, they also have high blood pressure. But what is paramount now is Cushing syndrome. This is a common disorder. Have you seen people that are, especially women, sometimes men, they are usually very fat on the neck, especially around the neck. You see fat on their neck. The face is round and they are gaining weight around their thighs, around the legs are thin. The legs are very slim, but from the chest upwards to the neck, they are gaining so much weight. Those kind of women can even have what we call stretch marks. Stretch marks. That is usually because it can be caused by too much cortisol. Too much cortisol. Eventually, these people will have high blood pressure, bone weakness, skin changes, and even stretch marks. We'll look at some of them. Cushing syndrome can usually occur when the cortisol level is high. That is why people that take a lot of steroids, prednisolone, dexamethasone, they can take it and take it, whatever they are treating. But sometimes, if care is not taken, they can have too much steroid that will lead to cortisol and that will lead to weight gain and all the signs and symptoms of Cushing syndrome. Look at this picture. This is a classical case of Cushing syndrome. You can see the stretch marks. Sometimes some women are not so fat. If you open their clothes, you see the breast has stretch marks, the abdomen has stretch marks, the bum has stretch marks, the thigh has stretch marks, plenty stretch marks. And if you look at them, you ask them, have you been gaining weight? They'll say yes. What's the blood pressure is high. And if you look at them in the mirror, the legs are very slim and small, but the entire body up is very, very thick, especially the neck. Look at this neck. You have a lot of fat around the neck. The arms are thin. The stretch marks are all over the intestine, the abdomen. Then we have the skin, very, very thin. Every small thing, a wound can take place. Look at the face. It's a round face, round moon face with red cheeks, and then you have fat around the neck. That is one of the things we see in Cushing syndrome. Of course, it's the same thing. Look at the tummy, very big. It's not pregnant. The arms are very thin. The legs are thin. The stretch marks is all over the tummy. Then on the neck here, you see a lot of fat. Then the facial, if you look at the face, it's always red. You know that they rub something, the face is red and round. That is classical Cushing syndrome. Most of them, they have, what is the problem, symptom they have? They have emotional disturbance, they have moon face, their bones can break easily. They are usually on the fat side, obesity. Their skin is wrinkled, they have abdominal stretch marks, the muscles are weak, and they normally can have poor wound healing, just like diabetes. It can even lead to diabetes, actually. Look at this classical picture. This woman is a case of Cushing syndrome. See the neck fat all over with a round face. The same too. That is what happens in Cushing syndrome. The steroids can be produced from the body, or the body is taking, person is taking it from outside by medications. At the end of the day, it leads to. So what are the symptoms? We've mentioned them: round face, fatty deposit on the back, what we call the buffalo hump, muscle weakness, and back ache, all due to bone loss. Then they have high blood pressure, high blood sugar, diabetes. We mentioned that they are always thirsty and urinate a lot. They have reproductive problems, inability to have pregnancy because their period are irregular periods, increasing facial hair, and infertility. That's for the women. For the men, they have decreased libido with erectile dysfunction. In children, they have slow growth. And then, okay, I think that is just all for now about that. So the areas of emphasis are the ones that have been made known to you. I would think I'll send the slides while you do the reading. I think I'll stop here for now. Yeah. I want to stop. I hope it's fine, right? Hello. Yeah, I think we can, okay, end it there. I hope you are with me. Hello. Ebere, Fatima, and
With you, sir.
Stephanie, Karim, I hope you heard me. I hope you heard me, right? Oh, the sound from your end is not coming. Okay, so we have come to the end. We have come to the end. So I think it's okay. It's fine. So let me call it a day here. I'll send the slides to you guys, okay? All right. Take care of yourself and enjoy your stay tomorrow in the environment there. Bye. Okay.